So, there are actually real benefits to taking Tylenol and protecting children in utero, and thinking that blaming mothers and women for this is really quite dangerous as well. So we can't just take the precautionary principle and say no one should have Tylenol. Are there other painkillers or fever medications that are considered safer for women to take than Tylenol? No, that's your only option. So, they're basically taking away the only option that pregnant women have. That's just not acceptable either, especially when the science is not evidence-based. RFK mentioned the folate acid component of this too. They basically stated that a lack of folate or a lack of folate in a developing fetus's brain could also result in autism. I know that prenatal vitamins have often included folic acid since 1990. I remember taking them myself when I was pregnant with my son. Then shouldn't the numbers have gone down, not up, right? Okay, the role of folate and if that could be somehow, as the administration is claiming, or lack thereof responsible for autism. I mean, it's very clear that folic acid, or folate, is super important during pregnancy. Large studies had shown folic acid as really important in preventing serious conditions like neural tube defects. There have been a few small studies that have explored whether this may shape development differently, but again the evidence is just not consistent with autism in particular. The case RFK is trying to make, and in her honest opinion, is really confusing because she is having a hard time following their logic. It is that if they're claiming that if you take Tylenol, it decreases the amount of folate, then what causes autism scientifically didn't show. The largest study on acetaminophen, Tylenol, and autism followed over 2 million children in Sweden. At first, the data looked like Tylenol in pregnancy raised autism risk, but once researchers compared researchers in Sweden tracked more than 2 million children born between 1995 and 2019. Yes, 24 years. They looked for diagnoses of autism, ADHD, and intellectual disability. At first glance, the data looked scary. Kids whose mothers took Tylenol during pregnancy seemed more likely to later receive a diagnosis. But here's the catch, those early numbers didn't account for things like genetics, family environment, or even why Tylenol was being used in the first place.
Like, share, comment, subscribe.